We always had psychology books at home. My father specialized in the field of educational psychology. So I had access to his books and I liked the topic. And I was among the first cohort to graduate from the medical school established for Palestinians. And during my clinical training in different parts of the West Bank and in Jerusalem, in primary healthcare and in general hospitals, I noticed that there are many people who come to see the general doctor for medically unexplained symptoms. It was during the Second Intifada. That was an uprising in reaction to the occupation when I did this clinical work. And there were many laborers who didn't get a job as a way to punish and pressure. And I remember a woman that we received in the emergency room of a hospital in Jerusalem, coming from a village of Ramallah. And she could not see, but there was nothing wrong with her eyes. So we sent her for a consultation in the ophthalmology hospital, and she came back, and her report was saying that she had no organic cause for the loss of vision. And her story is that she observed her son being shot in his eye, and she lost her vision after seeing what happened to her child. So at that point, I decided to specialize in psychiatry. And I was privileged to get a scholarship from the French government to go and specialize in psychiatry in Paris.
That's a powerful story in itself, isn't it? I understand that liberation psychology is something that when you're looking at mental health, you have said that it needs to include the impact of colonisation. It needs to have a psychological understanding and a culture that can liberate the people's mind, parallel to the liberation of the land. Yeah. Very inspiring words. Maybe you could speak a bit more to them.
Yeah. In fact, all of my training in the field of psychiatry and mental health is based on the mainstream Western school. I got my training in France, and then I did some intensive courses in the UK. And then I had a 3-year program at the Israeli Institute of Psychoanalytic Psychotherapy. Yet when I started my clinical practice, I understood very quickly from the patient that I need to provide a service that takes into consideration the political and social factors that influence their life and cause a lot of suffering and pain for them. And in a way, my writing helps me reflect on the cases that I see. So I started my work as a district psychiatrist in the region of Ramallah for a catchment area of 400,000 people. And in France, I had 3 to 5 patients per day. In Ramallah, the first day of work, I had around 60 patients. And in some occasions, a mother of 3 children with autism would come to see me, but she wouldn't bring the children because she didn't afford the fare for transportation to bring them. So this is very different than where I got my training. So I had to start rethinking the Western training and the Western approach. I learned a lot from my patients. And I think that coming back to the story of this woman who lost her vision, the meaning of the symptom became very important for me, because I think the psychological symptoms that people present has a meaning, and often in the Palestinian situation, the meaning is related to the social stressors and the political stressors. I also learned from my practice that it is okay for people to come without a diagnosis, simply because they have distress and pain. And actually, people are more receptive to intervention if we don't pathologize their experience. In Palestine, you can imagine that many people have a lot of pain and suffering because of factors outside the self. A mainstream psychology and psychiatry usually tends to attribute the suffering to a personal dysfunction within the person. That will not work for many people. That will push many people away from our services. Soon after finishing my work as a district psychiatrist, I became the head of mental health services within the Palestinian territories, working for the Ministry of Health. I needed to strategize, develop national plans for mental health services. So in drafting these plans, I took into consideration the special differences between Palestine and other parts of the world. For example, within the West Bank, when we talk about Palestine, we are talking about very small geography, but the fragmentation has created different political determinants of health that makes vast differences in education, in life expectancy, in infant mortality rate. So we prioritize certain groups who are exposed to more disadvantages. For example, the Bedouin community in Area C in the West Bank. They are usually dispossessed and displaced by settlers. We have a big percentage of the Palestinian population who spend time in political detention. This is an experience that leaves fingerprints. It marks the psyches of people. So they have special needs. We try to adapt our strategies to the special needs of this particular group. When we talk about liberation psychology, I think it doesn't take into consideration only what's going on in our skulls, our individual and personal stories. It also takes into consideration the structural conditions that interact with the individual and influence to a great extent their perception of reality. So that's my practice of liberation psychology in Palestine.
I think here in Australia there is a growing understanding of this reality in relation to the people whose land was stolen from them, the ongoing impacts of that colonisation. It's not enough to take an individual approach, and hopefully that's a growing understanding. Have you studied that particularly, or is it a new
No, actually,
area?
In order to understand what can be done in Palestine, I exposed myself to mental health practice in the global south. I read a lot about mental health and psychology in Latin America during time of oppression. Ignatius Martin Baró, for example, author of a book on liberation psychology, and Paulo Freire, Pedagogy of the Oppressed. I'm familiar with the work of some sociologists also. For example, a Malaysian sociologist, Sayyid Hassan Al-Atas, who spoke about the captive mind and the myth of the lazy native. I know a lot about how our discipline, psychiatry and medicine, have contributed significantly to making colonization acceptable. For example, Frantz Fanon challenged the psychiatry school of Alger, Antoine Porot and his colleagues, who gave the diagnosis of the North African syndrome that explains that the North African is primitive and lazy and dishonest. In medicine, eugenics established the basis of racism. Some psychometric testing that were used, the Stanford Binet, for example, it provided an evidence that the white American is more intelligent than the Mexican. Instead of questioning the tool, the wrong conclusion was made about other people of color. So there is a lot that we can learn from the mistakes that were perpetrated by our discipline, but also from those courageous professionals who try to provide a different way of thinking and practicing. This exposure to those liberation thinkers in our field gives me the legitimacy to question the Western education I was exposed to. And on the top of that, I think that we Palestinians have the responsibility of generating knowledge from our own context, inspired by the work that was done in different places, but it is not the exact same challenges that we are facing. So we have this responsibility to generate knowledge from Palestine. And if we are open to learning from our patients, this is a very helpful resource.
Exactly. Dr. Jabr, I feel as if I've just had a little crash course in sociology. Thank you so much for that. Let's just move to your book, because this is your latest book, which has the very catchy title, Radiance in Pain and Resilience, the Global Reverberation of Palestinian Historical Trauma. Now, of course, the word that leaps out to every Anglo reader of that is radiance. Can you explain to us a bit more about that word?
I have to say that English is a third language for me, but I speak it good enough to communicate and share my thoughts with the world. So when I used the word radiance, two things were in my mind. In medicine, we talk about radiating pain, a pain that originates in a certain organ, but it can be felt in another part of your body. And also, we know that a smile can radiate, sunshine can radiate. So when we talk about pain and resilience, I think that the pain of the Palestinians can be felt in different parts of the world, many nations who experienced colonization, and many people whose ancestors were involved in colonization, and they have inherited the shame and guilt. So I think that there are reverberations for what is happening in Palestine in the world. And at the same time, I think that the resilience of the Palestinian people, and we use a special word for resilience in Palestine, we call it sumud. The resilience of Palestinian people can be inspiring for many people in the world. While Israel exports spying technology to the world and use Gaza and the Palestinian territories as a laboratory to advise the world about how to use their weapons, Palestinians can export their resilience to the world, their sumud. This is our gift to the world.
Wow. But I understand that you're part of a group called the Sumud Network for Mental Health. And I'm very interested, I'm sure my listeners will be too, to hear more about the international campaign to build an understanding of mental health that is constructive rather than destructive.
Well, Sumud Network is a network for mental health professionals who are concerned about what's happening in Palestine, and they realize that at this point we cannot provide the conventional interventions because there is no safety, and a basic requirement for our intervention is a safe place. So instead, what we are trying to do is to advocate and inform the world about what's taking place in Palestine. And we understand that a lot of the suffering is made by design. What Palestinians are living is not comparable to any accidental trauma. The trauma of colonization is deliberate, intentional, to force people into helplessness, to corner people. So the international colleagues of the Sumud Network try to educate the world and provide professional solidarity and document what is happening in Palestine. They use their skills and the special language of mental health to explain the Palestinian reality to a wider audience. I think mental health can shed a light and help many people to understand, even if they are not interested in politics or find politics very complex. Maybe from a mental health point of view, they can better understand.
Exactly. I think there are millions around the world watching in shock and also struggling to understand. Just on the topic of the network of health workers, not only mental health workers, but I think it seems to be very strong, and it's pretty obvious that health workers in Gaza are being targeted.
Of course, if you are a health worker in Gaza, the chance that you will be killed is 2.4 times in comparison to an average person, because the health system is a lifeline for Palestinians. So to target the health system means to inflict more killing and death and erasure. And this is not accidental, this is by plan. And I think they demonstrated an unusual expression of resilience and post-traumatic growth. I used to go to Gaza and train colleagues there, and I know that most of them multiplied their capacity to react, to respond to the need, to the crisis. They work for long hours, they speak about their observations, they provide witnessing. So they were targeted because the occupation doesn't want to leave positive role models for the Palestinian people. So they go after everyone who would be a positive role model for the average people.
Maybe we could move now to thinking about what can people do. So many of us watch as much as we can bear the continuing trauma of the occupation of Palestine and the new trauma being installed daily. You're an expert on trauma, I think there's no question about that. What are your thoughts about what it is going to take to break that cycle? Because, of course, we're talking about not only the trauma of Palestinians, but the historical trauma of Jewish settlers and Jews around the world, which contribute to the situation. What do you think can break that?
Well, if I may, I would like to question your question.
Please do.
Because I think there is an underlying assumption that Israelis are doing what they are doing because of their trauma, and I don't think so. Every colonization did something similar to what Israelis are doing now without the Holocaust in the background. French colonization did similar things. The colonization of the Congo. Every colonization, I think they are going by the recipe book of colonization. So I don't think that the Holocaust is a main factor in what they are doing now. We know many Holocaust survivors or people who have Holocaust survivors in their family who are outspoken about Palestine, who support in every possible way the Palestinian people. I think if the Holocaust is a factor in our reality now, it might explain the silence of the West, which is allowing so much harm. It explains why the world allowed a global anti-apartheid movement to end the apartheid regime in South Africa, while the solidarity movement with Palestine now is being attacked in every possible way in Western countries. So I don't think what the Israelis are doing now is a re-traumatic play of what their ancestors lived in Europe. But I think the silence of the world, the silence of the Western world particularly, can be explained by the Holocaust and their involvement in the Holocaust.
Thank you. That's very, very valuable. As somebody who's studied the project of trying to free Palestine, as somebody who's studied that up close, you've talked about people who can't maintain that, who burn out, who feel overwhelmed, who become immobilised rather than mobilised. Could you say a bit more about that?
Yeah, we're talking about people outside Palestine who are watching what's happening in Palestine. Yeah, I think one way to ground people in their involvement and engagement in solidarity movements is to help them understand why they do what they are doing. And usually people are very involved in doing, and they don't take the time to reflect on the true reasons. So is it because they have a similar history with Palestinians? For example, people in Ireland and people in the global south, they can see their images, the images of their grandparents in our eyes. And there are other people who support us by kinship. That's good, but it risks that it will become racism at a certain point. And there are people who support Palestinians because of their Islamic faith, and yet they are not equipped with all the important political arguments. And it becomes fragile if they don't have the strong political and humane arguments to render their solidarity stronger and more convincing. So I think knowing one's motivation is very important, but also I think people who are concerned about Palestine are affected to a certain level with emotional fatigue, burnout, or vicarious trauma, so they need to take care of each other. Collective trauma needs to be processed collectively. Collective care in addition to self-care. Connect with people in the Palestinian territories and rely on them as resources of information, of needs. It is important to take into consideration the well-being and mental health of all of those involved in solidarity for Palestine, and also to consider how to strategize activities, making advantage of moments of mobilization and organize their ranks in a way that makes the solidarity politically effective. It was impressive to look at the images of people on Sydney Bridge. This was huge mobilization. Now, the important question, when people go back home, how can we benefit from their engagement, their expression of solidarity? How to organize this huge number of people so that their emotions and their feelings can influence the government to stop shipping components that support Israeli military.
Yes. Can I ask you what it is that nourishes you or keeps you on track?
Faith is an important element. I believe in the Palestinian right to live as human beings with full rights and as a nation with sovereignty on their native lands, on the lands of our fathers and grandfathers. And also my Islamic ethics that help me to understand that people should find the satisfaction and the reward by the pathway, the journey that they take, not necessarily by the final destination or the end result. We don't judge things by the tangible, materialistic goals, but also the pathway, the choices that we make. And luckily I have good colleagues and friends who help me a lot, so I feel that I'm not doing this alone. And I really appreciate all the help and support and solidarity that I get from people within Palestine and outside Palestine. And also I think that I have the capacity to see little positive things in the dark picture. And this capacity is important to keep the hope present in my heart.
I imagine it's a discipline as well as a capacity.
Yeah.
That leads me, I think, very smoothly to introducing Dr. Jon Jureidini. Jon, can you introduce yourself? All I know about you really is that you're a psychiatrist and that you are backing this project of Dr. Jabr's tour around Australia.
I'm a psychiatrist. My family's of Lebanese background, but I have Palestinian cousins. And visiting them in Nazareth 30 years ago and being treated like a second-class citizen as I came through the Israeli border was a sort of instantly politicising experience, as it is, I think, for many people like me who perhaps visit that part of the world with relative ignorance when we arrive. So I've got a long-standing commitment to the Palestinian cause. And when we talk about liberation psychology, it feels to me that what's happening in Palestine is a critique of the whole Western approach to mental health. Everything that Dr. Jabr says about what's wrong with the Western approach in Palestine is pretty much wrong with the Western approach in the West. So there's an enormous amount we can learn. For example, the word resilience doesn't really do justice to what's meant by Samud, which is a much more social concept. It's about what happens interpersonally through connectedness, not something that resides somewhat sort of heroically in an individual, which is such a very westernized approach for the triumph of the individual over adversity. And the thing that comes through from reading Dr. Jabr's book is the way in which the Palestinian society somehow survives all of this oppression. And there's nothing mawkish about the expressions of hope. It's not kind of wish fulfillment or artificially. It's kind of real and heroic, not so much individually heroic as collectively heroic. So I think there's a lot that we can learn from these kinds of approaches to stop locating problems within individuals, to stop thinking that any time we're distressed it means we've got a broken brain and we need medication or therapy or whatever. So I just very strongly recommend this book, which is quite inspirational.
Very moving, and I just keep sitting here thinking about the experience of the First Nations people in this country and how often they have been seen as broken, whereas if anybody just looks for 5 minutes, they can see another version of extraordinary resilience to be able to maintain or repair communities and see what needs to happen and try to make it happen. Have you heard about the Uluru Statement from the Heart, Dr. Jabr?
No.
Perhaps John could describe that to you. I don't think we need to have that conversation here, but it was a statement from a big convocation of First Nations people in the centre of Australia. And the wording of it in itself is so beautiful. And the rest of the country is so slow about responding. It was an invitation to, fix this. Anything else?
I'd love to hear you tell a story again about the little boy with his kite and the drone.
Oh, yes. Zainab, my colleague, and myself, we wrote a paper about an intervention that helps children to deal with grief and loss. And this intervention is based on using the kites as a symbol. Kites are mentioned in Palestinian songs, in children literature. There is a famous poet who was assassinated in Gaza, Al-Arair, who wrote a beautiful poem about his anticipated death, saying, "Make my coffin white and buy a long string so that a child from Gaza can touch the string and receive love from his father." So we used this important symbolism of kites as a theme for an intervention. We gathered children who experienced home demolition, displacement, loss of family members. They collaborate on creating a kite. They make the kite with white paper. They draw whatever they want. They color it as they wish. They go fly it outside, and then they come back to the meeting room and they reflect on the experience, and they are allowed to speak about loss and connection. And this intervention was inspired by our observation of a young boy from Gaza. It was raining and his feet were stuck in the mud, but he was trying to fly a kite in juxtaposition of Israeli drones. So what I want to say is that our interventions try to meet the needs of people, and we are inspired by what the people do organically to help themselves, and we try to just be facilitators for the process that they start on their own. And also I want to say that in the Holy Land we have legendary stories like the ascension of Christ after crucifixion. We have a similar Islamic story of Al-Mi'raj, Al-Isra wal-Mi'raj, where also there is a story of a flying animal. So those are also symbolic stories that are very relevant to our reality.
Yes, I know that kite flying is a big thing in quite a lot of West Asian countries. It's a big thing, isn't it, for children to fly kites?
I think it is relevant. I saw it on the walls in some Latin American countries. I think wherever there is limitation, borders, and inhibitions, people try to find their way around it. Kites became very popular when the separation wall was constructed. For example, around Bethlehem, neighbors become 2 hour, 3 hour apart after the construction of the wall. So neighbors, friends, family members. So their way to defeat the wall was through flying kites.
Thank you so much for making the time to come in here. I will
Thank you
do
for
my
your
very best to spread the word, to pass on your long and good thinking.
I want to thank you for your interest, and I want to thank all the colleagues and friends in Adelaide who made my trip here possible, and also the Wakefield Press that made my work known to the Australian readership and population. Thank you.